Hello, this is Robin at Vet Comp and Pen. I'm going to talk about Gerd today, gastroesophageal reflux disease, otherwise known as heartburn. They call it heartburn because literally it's a burning in the chest. It feels like it's happening in your heart. It's actually happening in your esophagus, but it feels like it's right where your heart is. And many people end up having severe heartburn, end up in the ER because they think they're having a heart attack. They think that, that sometimes they experience pain like they've never had, and it's right there, and they think, oh my gosh, I'm having a heart attack. Happens very frequently. Some of the symptoms of acid reflux or GERD are pain, epigastric pain, regurgitation, where you get this sour taste in your mouth, especially if you lie down after a meal, burning like something, somebody's burning you with a match almost. Substernal pain right underneath your sternum, or it can radiate into your arm and your shoulder sometimes, the pain from acid reflux. To get the 10% rating, you have to have 2 of these symptoms. Most people that suffer from GERD qualify because it's very common to have at least 2 of those symptoms. For 30%, you have to have all of those symptoms, plus you have to show a considerable impairment of health. Now, considerable impairment of health is not well defined by the VA, of course, like many things. If it's affecting you to the point where you lose a little bit of weight, or you can't eat certain things, or you can't lay down and sleep well, things like that can be a significant effect on your health. So, to get the 60%, you have to have all of those symptoms above, and you have to have severe impairment of health. Severe impairment of health could be development of Barrett's esophagus, which is an abnormal tissue growing in your esophagus that actually can lead to cancer. It's a significant problem, and it can be caused by severe gastroesophageal reflux disease, or a low blood count. You're actually losing blood, chronically bleeding. You have blood that shows up in your stool called melena. That's showing that you have significant GERD problems that are actually causing you to lose blood in your gastrointestinal tract. Some veterans are service-connected for GERD because they are diagnosed on active duty, and they are directly service-connected. They claim it, and they developed it on active duty, and they continue to have that chronic problem. But many veterans actually qualify for GERD on a secondary basis because many veterans are service-connected for conditions that they're taking medicines for that can cause or aggravate acid reflux condition. Non-steroidal anti-inflammatory drugs for musculoskeletal service-connected conditions. Many veterans take NSAIDs chronically for pain from their joints that they're service-connected for. If you're service-connected for a disease or condition that you have to take oral steroids can really drive up your symptoms of acid reflux and even cause acid reflux that you didn't have before. Mental health conditions can cause a secondary acid reflux condition. So there are many things that veterans may not even realize that they're service connected for something that they would provide them, medically qualify them for a secondary claim for acid reflux. To show a secondary, prove a secondary claim, you have to meet that threshold of it's at least as likely as not that you would not have the GERD if it were not for your service-connected disability. So you have to show that with medical evidence. That's all I got today on GERD claims. Remember, you can't be service-connected for 2 conditions in the abdominal area. So you can't have a rating for IBS and GERD. You're going to get the higher of the 2. They separate the esophagus, the lips, the mouth from the lower GI tract. So if you have IBS or GERD, you're not going to get both ratings. If you have esophageal strictures and can't swallow because you have a closing off of your esophagus, you can get that separate rating, but you can't get IBS and GERD ratings together. It's pyramiding. They won't give you both ratings. They'll give you the higher of the 2. If you have hemorrhoids, you can have a separate hemorrhoid rating, but you can't have 2 ratings of GI conditions in the abdomen. So thank you for listening. I appreciate it.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances in all cases.